Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon so you never miss an update. Today, we're going to learn about the female pelvis, an important topic that will help you in your practical examinations and Viva. So go ahead, subscribe, and let's get started. The female pelvis is a basin-shaped ring of bones that connects the spine to the thigh bones. It supports the weight of the upper part of the body and helps in standing, walking, and sitting. The female pelvis is a very important part of the body because it connects the upper body to the legs and helps in movement. It supports us when we walk, run, sit, or kneel by carrying the weight of the upper body and transferring it to the legs. When we sit, our body weight rests on the pelvic bones, which help us maintain balance and posture. It also protects important organs like the urinary bladder and reproductive organs. Most importantly, the female pelvis is specially shaped and wider to support pregnancy and allow the baby to pass safely during childbirth. The pelvis is made up of 4 bones. First, there are 2 hip bones, also called innominate bones, one on the right side and one on the left side. These are the large bones you can actually feel at your waist area. Then at the back, we have one sacrum, which is a triangular bone that connects the spine to the hip bones. And finally, at the very bottom, there is one coccyx, which is a small bone also called the tailbone. So remember it like this: 2 hip bones in the sides, 1 sacrum at the back, and 1 small coccyx at the bottom. Easy for Viva, right? Okay, students. Now let's talk about the innominate bone. Each innominate bone, hip bone, is made up of 3 parts: the ilium, ischium, and pubis. Today we're focusing on the ilium. The ilium is the large, wide, flared-out upper part of the hip bone. It's the biggest part. If you place your hands on your waist, the hard bone you feel under your hand is the iliac crest, which is the upper border of the ilium. So whenever you stand and keep your hands on your hips, you're actually touching the ilium. Easy way to remember, right? Now, let's talk about the ischium in a very simple way. The ischium is the thick, strong lower part of the hip bone. It is designed to bear weight. There is a large rounded part called the ischial tuberosity. This is very important, because when you sit down, your body weight rests on this part. That's why it is often called the sitting bone. So remember it like this: when you sit, or sitting on your ischium, just behind and a little above the ischial tuberosity, the sitting bone, there is a small pointed projection called the ischial spine. Think of it as a tiny inward-pointing bump on the inner side of the pelvis. It is not as big as the tuberosity, but it is very important. In obstetrics, doctors use the ischial spine as a landmark to assess the position and descent of the baby's head during labor. Now, let's understand the pubic bone in a very simple way. The pubic bone forms the front part of the pelvis. It is the bone you can feel in the lower front area of your hip. It has 2 branches, called the superior ramus and the inferior ramus. You can think of them like 2 arms extending from the pubic bone. These parts join with the opposite side in the middle to form the pubic symphysis. So remember it like this: front part of pelvis, pubic bone. It has 2 branches, superior and inferior ramus. The 2 pubic bones, one from the right side and one from the left side, come together in the front, exactly in the middle. The place where they meet is called the symphysis pubis, or pubic symphysis. It is a slightly movable joint made of cartilage. This joint helps in giving strength and stability to the pelvis. During pregnancy, it becomes a little more flexible to help in childbirth. Now, let's talk about the sacrum. The sacrum is a large, wedge-shaped bone present at the back of the pelvis. You can think of it like a triangle placed upside down, broad at the top and narrow at the bottom. It connects the spine to the 2 hip bones, so it helps in transferring the weight of the upper body to the pelvis and legs. The sacrum is not just one single bone originally. It is formed by 5 vertebrae that are fused together. These vertebrae join during adulthood to form one strong bone. The upper border of the first sacral vertebra projects slightly forward. This forward projecting part is called the sacral promontory. It is an important landmark in obstetrics because it helps in measuring the pelvic inlet. On both sides, the sacrum extends outward. These side extensions are called the ala, or wings of the sacrum. They look like small wings spreading out from the upper part of the sacrum, and help connect the sacrum to the hip bones. The anterior surface of the sacrum is smooth and slightly curved forward. Because of this curved shape, it is called the hollow of the sacrum. On this front surface, there are 4 pairs of small openings called sacral foramina. These holes allow nerves to pass through and supply the pelvic organs and lower limbs. Now, if you look at the posterior surface of the sacrum, it is rough and uneven. This roughness is important because it provides attachment for muscles and ligaments. Now let's talk about the coccyx. The coccyx is the small bone at the very bottom of the spine. It is also called the tailbone because it is a vestigial tail, meaning it is a leftover part from our ancestors. It is formed by 4 small vertebrae that are fused together. It is small and triangular in shape, with the base above and the tip pointing downward. Even though it is small, it is important because some muscles and ligaments attach to it, and it helps support the body when sitting. Let's talk about the pelvic joints in a very simple way. There are 4 joints in the pelvis. In the front, there is one symphysis pubis, where the 2 pubic bones meet in the middle. On the back side, there are 2 sacroiliac joints, one on the right and one on the left, where the sacrum joins with the hip bones. And at the very bottom, there is one sacrococcygeal joint, where the sacrum joins with the coccyx. Now let's understand the strong pelvic ligaments in a very simple way. Ligaments are strong bands of tissue that connect bones to bones and give stability to the pelvis. First, the strong interpubic ligament is present at the symphysis pubis. It helps to hold the 2 pubic bones together in the front. Next, there are 2 sacroiliac ligaments, one on each side, which connect the sacrum to the hip bones. These are very strong and help in supporting body weight. There is one sacrococcygeal ligament, which connects the sacrum to the coccyx at the bottom. Then we have 2 sacrotuberous ligaments and 2 sacrospinous ligaments, one on each side. These help stabilize the sacrum and prevent it from tilting too much. Now, let's talk about the parts of the pelvis in a very simple way. The pelvis is divided into 3 main parts: the brim, the cavity, and the outlet. The brim is the upper opening of the pelvis. It is also called the pelvic inlet. It forms the boundary between the false pelvis above and the true pelvis below. This is where the baby's head first enters during labor. The cavity is the middle part of the pelvis. It is the curved space between the brim and the outlet. The baby passes through this area during childbirth. The outlet is the lower opening of the pelvis. It is the final part through which the baby comes out during delivery. Now, let's understand the brim of the pelvis in a very simple way. The brim is the upper opening of the true pelvis. It is almost round or oval in shape, but it is slightly indented at the back because of the sacral promontory. Now, let's talk about the landmarks of the brim. If you trace the brim in a circular manner, these are the important points you will see. Sacral promontory, the forward projecting part of the sacrum at the back. Ala of sacrum, the wing-like parts on either side of the sacrum. Sacroiliac joint, where the sacrum meets the hip bone. Iliopectineal line, a ridge on the inner side of the hip bone. Iliopectineal eminence, a slight elevation along that line. Superior ramus of pubic bone, part of the pubic bone forming the front boundary. Symphysis pubis, the joint in the front where the 2 pubic bones meet. Now let's clearly understand the true pelvis and false pelvis in a simple way. The pelvis is divided by the pelvic brim into 2 parts, the false pelvis and the true pelvis. The false pelvis, also called the greater pelvis, is the upper part. It lies above the pelvic brim. Its main function is to support the abdominal organs, like the intestines. It does not have a role in childbirth. The true pelvis, also called the lesser pelvis, is the lower part. It lies below the pelvic brim. It contains the pelvic organs such as the bladder, uterus, and rectum. Most importantly, it plays a major role in childbirth, because the baby passes through this part during delivery. So remember it simply. Above brim is equals false pelvis, supports abdominal organs, no role in childbirth. Below brim is equals true pelvis, contains pelvic organs, important in childbirth. Now, let's understand the diameters of the pelvic brim. There are 3 important diameters of the brim. First, the anteroposterior diameter. This is a straight line from the sacral promontory at the back to the upper border of the symphysis pubis in the front. It measures about 11 centimeters. Second, The oblique diameter. This runs from one sacroiliac joint to the iliopeconeal eminence on the opposite side. It measures about 12 centimeters. Third, the transverse diameter. This is the widest diameter. It runs across the pelvis between the two farthest points on the iliopectoneal lines. It measures about 13 centimeters. Now, let's understand the pelvic cavity. The pelvic cavity is the middle part of the true pelvis. It extends from the pelvic brim above to the pelvic outlet below. This is the space through which the baby passes during childbirth. In front, anteriorly, it is formed by the symphysis pubis. At the back, posteriorly, it is formed by the sacrum. The cavity is almost circular in shape, and all its diameters are approximately 12 centimeters. Now let's clearly understand the pelvic outlet. The pelvic outlet is the lower opening of the true pelvis. It is the final passage through which the baby comes out during delivery. There are three important diameters here. Antero-posterior, AP diameter. This is a line from the lower border of the symphysis pubis in the front to the sacrococcygeal joint at the back. Oblique diameter. This runs between the obturator foramen and the sacrospinous ligament. It measures about 12 centimeters. Transverse diameter. This is the distance between the two ischial spines. It measures about 10 to 11 centimeters and is the narrowest diameter, which is very important in labor. Now, let's understand the four types of pelvis in a very simple and exam-friendly way. There are four main types based on the shape of the pelvic inlet. Gynecoid pelvis. This is the typical female pelvis. It is round in shape and is ideal for childbirth. Most women have this type. Android pelvis. This is the typical male-type pelvis. It is heart-shaped and is not very favorable for normal delivery. Anthropoid pelvis. In this type, the antero-posterior AP diameter is longer than the transverse diameter. It is oval-shaped from front to back. Vaginal delivery is possible, but may take longer. Platypelloid pelvis. This is a flat or kidney-shaped pelvis. The transverse diameter is wider than the AP diameter. Engagement of the baby's head may be difficult. All right, students. That brings us to the end of today's session. Thank you so much for watching. I hope this class helped you understand the female pelvis clearly and made it easier for your practical exams and Viva. If you found this video helpful, don't forget to like, comment, and share with your friends. And most importantly, subscribe to Learn with Professor Janula and press the bell icon so you don't miss our next class. See you in the next session. Keep learning and keep growing.